Things were so much simpler back then. A new government, an open tone. Promises to listen, work together, even to get along. Climate was the main focus of that March First Ministers' Conference. It will be on Friday, too, as the Prime Minister and the Premiers meet to finalize the Pan-Canadian climate deal.
Bonjour tout le monde, bienvenue à l'entourage pour cette...
But the Premiers threatened not to show up for the climate talks unless they also got talk about increasing health funding to the provinces. Faced with the possibility of one of his signature issues getting sidetracked or even sabotaged, the Prime Minister's office blinked and organized a working dinner on health care, an interesting and perhaps telling move. Tim Murphy was Chief of Staff to former Prime Minister Paul Martin.
The issue was, what did you look like if you didn't even care enough to talk about the issue, right? You were going to have a tough time justifying saying, yes, I held a meeting with all of you, but I'm not even going to talk about health care. So I think quite rightly they came to the conclusion, we'll have a discussion about health care, but we're concentrating and we'll have a big official communique about climate change and moving forward on that.
Ah, yes, climate change. Back in Vancouver, it all sounded so easy.
We need to think about the things we have in common, and I think we can accomplish something if we talk about all of the other things that we can do to reduce climate change.
Rooted in collaboration.
Everyone was on side that day in March.
There will be different approaches, but pricing carbon is part of the solution that this country and all of its premiers will put forward.
All right, big smiles, guys.
Everyone signed on to the Vancouver Declaration.
So today I am pleased to say that in partnership with the Prime Minister, another important milestone has been reached.
Then, a few weeks ago, seemingly out of nowhere, this.
If neither price nor cap and trade is in place by 2018, the Government of Canada will implement a price in that jurisdiction.
In those words, some heard echoes of the former government. What happened to negotiating, to working together?
We're struggling a little bit to understand where the PM's message came from today.
Today is not a good day for federal-provincial relationships.
Saskatchewan Premier Brad Wall even mused about taking the federal government to court over it.
I'm going to continue to fight this fight. I'm not sure how much company we'll have, and I don't really care.
Nova Scotia's Stephen McNeil argued his province already pays through the nose for electricity because of the province's fast transition away from coal.
I have made it clear that a carbon tax is not the right way to go, in my view, for the economy of Nova Scotia.
Justin Trudeau knows that about 85% of Canadians already pay a price on carbon, or soon will. For the ones who don't, and the premiers who didn't want them to, Trudeau appeared to show some flexibility. Last week, the Prime Minister extended an olive branch to Saskatchewan.
We have also approved the Line 3 replacement project.
Line 3 runs right through the province, meaning jobs. And Alberta's Rachel Notley had already signaled that her support for a national climate plan was contingent on pipeline approval. So, will that kind of horse trading extend to health care? Given that the Liberals campaigned on a promise to negotiate a new health accord, the provinces probably thought they were good. Again, not so fast. Under the 2004 health accord, provinces received a guaranteed 6% increase to their transfers every year. Stephen Harper announced that 6% would be reduced to 3% come 2017. Well, it turned out the Trudeau government is just fine with that cut.
There is work to be done, and the work that we need to do for Canadians is not about spending more money.
The health minister did say Ottawa would offer $3 billion over 4 years to the provinces, but with strings attached. The money must be used for home care. Funding home care was one of the Liberals' campaign promises. If that didn't get premiers feeling territorial, this sure did.
Canadians expect that new money invested by the federal government into health care be actually spent on health care.
the federal government is here telling us that we're not doing our job, I think we're doing our job.
What I think is likely is the government said, look, we know we're going to have to talk about this at some point. Healthcare is an issue where there is clearly a shared jurisdiction, but at least we can start to have the discussion so that the provinces aren't saying, you know, in essence, converting what I think the Prime Minister hopes is a good news event around climate change and the plan for climate change into a bad news story because the provinces are upset and concerned about healthcare.
So now Trudeau has one key issue seemingly under control, another still a work in progress, and a lot at stake.